Welcome to the Deep Dive. Today, we're digging into a really crucial study. It's from the Lancet Regional Health Europe, and it looks at the urgent link between climate change and infectious diseases, specifically here in Europe.
Yeah.
Our mission, as always, is to pull out the key insights, get you up to speed quickly on something that, really impacts all of us.
And it's timely. The World Health Organization basically calls climate change the defining global public health threat this century.
Right. So how do we even start to grasp something that big?
Yeah.
The source mentioned a framework.
Exactly. And that's key. It helps break it down. It's about this interplay, you see, between hazard, exposure, and vulnerability.
Okay.
So the hazard is the climate event itself, like, say, a heat wave. Exposure is about who or what is in the path of that heat wave.
Makes sense.
And vulnerability, that's about how susceptible people or, systems are to the harm. It's about seeing the whole picture, the whole chain reaction.
That framework definitely helps. And Europe is, we're already seeing these climate shifts, aren't we?
Oh, absolutely. Big time. We're getting more frequent, more severe heat waves. Water availability is all over the place. Droughts down south, but then these terrible floods up north. Remember July 2021? Over 200 people died in those floods.
Yeah, devastating. And 2020 was the warmest year on record for Europe, wasn't it?
It was. So this isn't theoretical anymore. It's happening.
So how directly does that warming, those floods, translate into actual diseases?
Very directly. And this figure is quite startling. The study says nearly 2/3 of pathogens affecting humans and domestic animals in Europe are climate sensitive.
2/3. Wow, that's huge.
It really is. It just shows how climate change is sort of turbocharging the spread across many different disease types.
Can you give us some specifics, maybe starting with those vector-borne diseases, the ones spread by insects?
Yeah, good place to start. West Nile virus is a big one. Cases surged back in 2018, over 2,000 local human cases in Europe.
The 2,000.
Yeah.
Just locally acquired.
Yep. And the virus, which is carried by birds and mosquitoes, specifically Culex mosquitoes, it's popping up in new places. Germany, the Netherlands, areas that didn't really see it before.
And what's driving that spread?
The study points to things like warm early springs and then particular rain patterns, like a wet spring followed by a drought. Seems to create perfect mosquito breeding spots.
Huh. And it's not just West Nile, right?
Yeah.
I hear about diseases we usually think of as tropical showing up.
That's right. Dengue and chikungunya are definitely on the radar. The Aedes albopictus, the Asian tiger mosquito, is the main culprit there.
Right, I've heard of that one.
Yeah, and even though it's sort of a tropical bug, it's doing really well across Europe. It's reached northern France, parts of Germany, and that's led to actual local outbreaks. Italy had a big chikungunya outbreak in 2017, nearly 500 cases. And we're seeing sporadic dengue cases in France and Spain, too.
So it's establishing itself.
It seems so. And then there are ticks. Things like Lyme disease and tick-borne encephalitis, or TBE. The main tick carrier, Ixodes ricinus, is also moving, heading north and up into higher elevations. Milder winters, longer springs and autumns, it all helps them thrive.
Okay, so it's mosquitoes, it's ticks, but it's not just things that bite us, is it? What about our food?
Good point. Foodborne diseases are definitely part of this. Things like Campylobacter and Salmonella, common causes of, stomach bugs, they're very sensitive to temperature changes.
How sensitive?
Well, the projections are pretty stark. The source suggests we could see almost a 200% increase in campylobacteriosis in Scandinavian countries by the end of the century, just because the transmission season gets longer.
200%. Wow. And with more extreme weather, I guess waterborne diseases are a worry too?
Exactly. Heavy rain, floods, they could just overwhelm older water systems. That leads to outbreaks. Leptospirosis is one linked to warm, wet conditions and floods. And even the seas warming up is an issue. Rising sea surface temperatures are letting certain bacteria, pathogenic Vibrio species, thrive in places like the Baltic Sea. That's a concern for swimmers, for anyone using the water recreationally. The ECDC, that's the European Center for Disease Prevention and Control, actually tracks this.
Okay, so the picture is
That's concerning.
widespread threats. What can actually be done? What are the adaptation strategies?
Yeah, and that's where the source gets really interesting. It's not just about reacting, it's about building resilience. For vector-borne diseases, Think smarter surveillance, using big data like flight passenger info, even anonymized Twitter data to track human movement in real time.
Wow, using Twitter data.
Yeah, alongside things like getting rid of mosquito breeding sites, obviously, and developing new vaccines, the success of the COVID mRNA vaccines has really spurred on innovation there.
Okay, that makes sense for vectors. What about water and food safety?
For water, it's about upgrading infrastructure water treatment plants, pipes making them robust against floods, plus better weather forecasting for early warnings. Like that ECDC Vibrio map viewer for the Baltic, that's an early warning tool.
Right.
And for food safety, it's a mix. Things on the farm, like fly screens and chicken coops, better public education about handling food safely in warmer weather, and crucially, maintaining the cold chain, keeping food refrigerated properly from farm to fork.
It really connects back to that framework you mentioned at the start, doesn't it? Hazard, exposure, vulnerability. All these strategies seem to tackle one or more of those.
Precisely. And that's why things like the EU's Green Deal or the European Climate and Health Observatory are so important. They're trying to boost preparedness across the board, addressing all three elements.
It really underlines how interconnected everything is.
It does. Which leads to a final thought, maybe for you listening. Given how widespread these climate impacts on health are, what's one area of public health, maybe something we haven't touched on much today, that you think needs more urgent focus in our warming world, something to consider?